There was an interesting article in the Wall Street Journal today about how chronic diseases really are becoming a bigger and bigger issue in American health. Things like diabetes and obesity. There are lots of things contributing to that, but one of the things that they highlighted, which I appreciated, was that compared to other like-minded wealthy nations, Americans stay with the same primary care physician much less frequently. So for example, in the Netherlands, over 75% of their population can say, yes, I've stayed with the same primary care physician for 5 years or more, whereas in the United States, only about 40% of our population can say that. I'd like to speak to that as a practicing primary care physician in internal medicine for over 20 years. I definitely understand the value of continuity of care and having a relationship with patients that over time. So one of the main reasons why I think this is happening is that there's a shortage of primary care physicians. So when you graduate from medical school and you look at all of the different options and you see primary care, things like family practice and internal medicine, in those fields, you're expected to know a little bit about everything. Versus if you go into a specialty, you're really siloed into one particular aspect of the body. So if you decide to go into cardiology, you need to know a lot about the circulatory system, so your knowledge base is much deeper about that particular subject. But in internal medicine, I'm expected to know a little bit about everything, and I'm paid less. So I'm expected to know a little bit about everything, but I'm paid less than my colleagues that go into specialty fields. Secondly, insurances have not done any favors to us over the years. I've cultivated relationships with patients over years and years only to have them switch insurances for various reasons. And then they're no longer able to come see me because that particular insurance wasn't accepted by my clinic. And that's always really sad for me, and I'm sure for the patient too. Sometimes they'll come back to me, but oftentimes they won't. But I do know the deep value of having a relationship with patients that's cultivated over years, where you really cultivate trust and get to know the patients. I feel like once you really get to know patients, you're able to speak to some of those more concerning aspects of their health, like their weight and things like tobacco use and alcohol use. But you have to have a relationship with them that's cultivated, and they know that you care for them and they trust and value your opinion. It's a problem in the United States. I don't see it getting better anytime soon, but I appreciate that it was highlighted today.